Hello everybody! In honor of May being Lyme Disease Awareness Month, I wanted to create this quick little video about the common misconception that Lyme disease is easy to diagnose through a blood test and or a bullseye rash. Many people that have tested positive for Lyme or think they have Lyme or have chronic Lyme have probably had lots of negative tests before they had a positive one. And here are some of the reasons this may be the case. In the early stages of the disease, these numbers change depending on where you're doing your research, but approximately 50 to 70% of patients develop a bullseye rash at the site of a tick bite. Others do not develop a rash, but develop flu-like symptoms, including fever, headache, and joint swelling. These folks may simply assume that they had a case of the flu and never suspected that their symptoms were caused by an infected tick bite. Now, for those that do suspect Lyme disease, some individuals go to their primary care doctor and get tested. The standard two-tier Lyme disease test is a blood test that detects whether the body has developed antibodies in reaction to the presence of the bacterium. Antibodies may not develop immediately, so if the test is taken too soon after a person is bitten by a tick, the results will likely be negative. Moreover, individuals with compromised or weak immune systems may not produce detectable levels of antibodies in response to an infection, and so they will also test negative when in fact they are actually infected. This two-tier blood test for a Lyme disease diagnosis was developed by the Food and Drug Administration and the CDC and others in 1994 and adopted by the Infectious Diseases Society of America as a standard protocol. The first step is an ELISA, followed by an antibody test known as the Western blot. The accuracy of these tests are dismal because the first tier ELISA is at best about 70 to 75% sensitive. Many ELISA and Western blot Lyme disease tests are only equipped to detect one strain of one species of Borrelia, which is Borrelia burgdorferi. This means that those tests are missing infections caused by other strains and or species of Lyme Borreliae. Many times after testing negative through the Western medical system, people end up going and purchasing the IGeneX Lyme Immunoblot. This test detects more species than the traditional ELISA and Western blot, reducing the risk of false negatives due to the inability to detect antibodies to a certain strain or species. The test includes all Borrelia-specific antigens relevant in North America and Europe, not just Borrelia burgdorferi. The result is a single test that replaces at least 8 Western blots. The immunoblot is considered a more accurate form of testing because it uses specific recombinant proteins that are sprayed in precise amounts onto specific locations on the membrane strip. This makes reading the bands much more accurate and consistent. The immunoblot also offers earlier detection and can detect infections at multiple stages of the illness, letting you catch and treat infections earlier. Without accurate multi-species tests that can detect infection at all stages of disease, patients can't get a diagnosis and can't get better. To learn more about the IGeneX Lyme disease test, you can go to their website, which is igenex.com, or speak to your doctor about this test. It'll likely be a naturopath or functional medicine doctor. I don't know many doctors from the Western medical systems that do this test, but maybe there are some. That's all I got. Thanks, everybody.